Hello, this is Meram Azzani from the Department of Public Health Medicine, UITM, and today I'm going to present a bibliometric study on occupational mental health illness in industry. So this is the outlines of my presentation. And at the beginning, I would like to highlight that occupational mental health illness is a progressively recognized concern in the various industries affecting the workforce, productivity, and well-being. WHO states that 15% of working-age adults to have a mental illnesses in 2019. Furthermore, the loss of productivity due to depression and anxiety alone cost global economy $1 trillion annually. Many of studies have reported escalating level of burnout, stress, and several mental health disorders among employees. And these results shed the light on the urgency of addressing mental health crises within the industrial workforce. COVID-19 pandemic has had a profound impact on occupational mental health, affecting various aspects of the work life and mental well-being. It led to a significant increase in publications on occupational mental health. This surge can be attributed to several key factors that have driven researchers to explore how the pandemic has affected mental well-being in the workplace. Hence, this paper aims to analyze and interpret the contributions of different scholars, the trends, subject area, map research, network citations, and to identify the key journals and academic publications in the field of occupational mental health illness in the industry using statistical and mathematical techniques. So by examining the current state of research and drawing connections between various studies, we aim to contribute to the growing body of knowledge to produce a quantitative basis for understanding and improving the impact and the efficiency of academic research on OMHI. So in the methodology of this paper, we use the bibliometric analysis. So let me define the bibliometrics. Bibliometrics includes the coordination, organization, and analysis of bibliographic information extracted from scientific publication. More than providing just descriptive facts such as the key author categorizations, publication year, and publishing journals, it involves also advanced techniques such as document co-citation analysis. So it's very helpful. It can involve in identifying the appropriate keywords and conducting literature research and conducting a meticulous analysis. So in this study, we utilize the Scopus database, and we included those articles who underwent a peer review. And we exclude books, and we limit our search until February 2024. And at the beginning, we just create our search keywords, which I'm going to show in the next slide. And then we just try to modify our search and limit it to the last 5 years. All right, so at the beginning, we got 3,752 articles. And after we limit the search to the last 5 years, we got in total 932 articles. So here are the search terms that we use in Scopus database, and here are our selection criteria: English articles, underwent a peer review, and we exclude books and English articles. For analysis, we use the Post Viewer, which is a sophisticated software for bibliometric and visualization, and help also to convert the complex bibliographic information into visual maps. And this software also enables the identifications of unseen pattern, trends, and relations within extensive database. So at the beginning, we prepare our dataset comprising evidence about publication year, title, author name, journal citation, and keywords in plain text. And then by using the software, we are able to examine, and also the software generate for us some of the maps. And let's see here the first graph, which is produced, which is describe the trends of the publication by the year. And we see there is upward trend, or there is increased number of publications throughout the years, and it reached to the highest in 2021. And in this figure, you can see the top 10 scholar research related to occupational mental health illness in industry. And such figure can be very useful for those people who are looking for the collaboration on this research area. And if you look for this pie chart, you can see the documents by subject area. And here, medicine, this is the largest category, which is indicating that over half of the publication come from the field of medicine. And in this map, in which it shows that the co-author relationship based on the countries, the context of the research on occupational mental illness, and it shows that the US and UK having the highest number of authors and also the strong link of collaborations with other countries. And this map also shows that on the co-occurrence of keywords and research related to occupational mental illness, it highlights that the term mental health upmost occurrence with the occupational therapy and COVID-19. And in this map also you can see that the researchers are not only focusing on the mental health issues, but they are also focusing on the other consequences of mental health, like absenteeism, like the return to work, like the occupational injuries, and also they are looking for the therapy for it and for the preventive measures like the health promotion. So let's now maybe try to discuss the trends in the document count and scholarly publications. So the line graph illustrated a rise in papers on occupational mental health illness from 120 in 2018 to 155 in 2023, with a peak in 2021. This trend likely reflects the growing interest of the increased awareness and technology advancement in the occupational mental health illness research. And it can also highlight the increase in the funding. Maybe the researcher got more support to study such issue from maybe industry or from the government or the private sector. All right. At the same time, maybe because of changing research priority, where now there is recognitions of the economic impact of the occupational mental health illness and new challenges in the prevention treatment of such issues among the employees. And the peak in 2021 may be linked to the COVID-19 pandemic impact on the mental health. According to the subject area distribution, we see that in the medical field, most of the articles are located in this field. 54.3% dominates, maybe due to focus on mental health as a medical issue, with significant contributions from the medical professionals and institutions. And it's followed by the psychology with 9.4%, and it's important for understanding stress, burnout, and anxiety in the workplace by the psychologists. For that, maybe also the high number of the articles comes from psychology field. And also there are some publications from health professions and social sciences. Maybe they are exploring the social and economic factors affecting the occupational mental health issues, and other disciplines like environmental science, like nursing, biochemistry, humanities, and so on. This can show interdisciplinary nature of the occupational mental health research. And if you are looking at the co-authorship collaborations or the international collaborations among authors, we can see some countries have substantial international collaborations like US and UK. However, other countries like maybe Taiwan and Saudi, they have the least link strength, and also they have the least number of the collaboration. All right. And regarding the keyword associations, terms as the mental health, COVID-19, occupational therapy dominates the keywords here, and this shows the importance of these terms, indicating the main thematic areas in occupational mental health illness research. And our recommendations for this study, we recommend the future research to collect additional data, obtaining comprehensive data, including the particular document counts and the years for each scholar. And this will support the precision of the analysis and enable a more understanding of the trend. And also it's good if they investigate the reasons behind the trend. Conduct a literature review or searching out for the scholar could support identify factors contributing to the observed trends. All right, and they may provide also deeper insights into the dynamics of occupational mental health illness research. And finally, if they can also combine the results with other bibliometric studies in the area or related field, can provide valuable data and recognize broader trends or patterns. So in conclusion, the bibliometric analysis discloses promising progress in occupational mental health illness research, as demonstrated by a growing number of papers, diverse subject area, contributions, impactful research, and global collaboration. The developing landscape of occupational mental health illness research is shaped by a complex interaction of factors, from growing interest and funding to shifting research priorities and dynamic impact of global events. So this comprehensive understanding sets the stage for continuing investigations and targeted interventions in the field of occupational mental health. Those references used in the presentations. Thank you for listening.